I want to welcome everyone and thank our co-sponsors, our Franklin County Public Health Department, as well as the Franklin County Office on Aging. And first I'm going to ask Joe Mazzola, he might be out. Yeah. I wanted to have our co-sponsor share some words from Franklin County Public Health. Also, as we're waiting to get started, I wanted to share that one of our speakers, our first speaker, is going to be online, and her name is Alex Jones, and so she'll be joining us shortly after we have some brief remarks from Joe Mazzola. And while we're waiting on Joe, I am going to say a little bit more about Freedom a la carte, and please forgive me, my eye has been watering. I slept, either I scratched my eye or something, but if you see it watering and I'm rubbing it, that's what's going on. But I want to share with everyone that we purposely have these events to provide an opportunity for our community residents to understand some of the policy issues that are taking place that impact the social determinants of health, which goes to overall health. As a federally qualified health center, we serve the most vulnerable in our community. We serve everyone, but we prioritize our services to those who are economically or socially or culturally challenged with barriers. And so we want to make sure, thank you very much, I'm echoing myself. We want to make sure that we address all of the needs of our community by addressing the social determinants of health. And so with that said, one of the other reasons we provide these quarterly community health advocacy breakfast forums, long title, is to provide an opportunity for various entities, organizations, governmental agencies, and others to share what they're doing to serve the needs of our community and to address the social determinants of health. I'm going to have Joe Mazzola, our Franklin County Public Health Commissioner, to come forward, who is one of the co-sponsors of today's event. And you can give him a round of applause.
Thank you, Charlotte. Thank you so much. I'm not sure where to look. Do I look here? Do I look out here?
That little camera is capturing you.
Okay. Well, good morning to everyone online, and good morning to everyone here in the room. I've actually been following these breakfasts for the last couple of years and been joining online for most of them. And I just want to thank Primary One Health for hosting these quarterly breakfasts. They are really important conversations, and at Franklin County Public Health, we're really pleased and excited to be able to partner with this particular conversation here this morning. A couple of things I'd like to say, maybe on behalf of the Health Department. First, I want to acknowledge Lisa Dent, who is our Associate Director of Equity and Inclusion, who is here in the room, and then Alex Jones, our Assistant Health Commissioner and Director of Prevention and Wellness, who has joined us online, and I think we'll give a few remarks as well. Also want to thank the Office on Aging for their partnership, and I'm really excited to hear from our partners at AARP as well. So, Franklin County Public Health, for those of you who don't know, we are the County Health Department. We serve our 17 townships, 10 villages, and then we also provide public health services for 14 cities in and around Franklin County. We work very closely with our colleagues at Columbus Public Health, of course provide public health services for the city of Columbus and the city of Worthington. But in all total, our health jurisdiction is about 500,000 people. We have a staff of about 145. And we are just thrilled to be able to continue to partner across our health jurisdiction to improve the health of our community. A couple comments I wanted to make that I think are of note and of relevance to this conversation. When we talk about social determinants of health, we are working on a new community health improvement plan for Franklin County. The center of that is really around social determinants of health and improving the conditions in which our residents live. So what does that mean for all of us here today? It's really about tackling the policies, the practices, the systems within our community that lead to health. And so whether education, like we'll talk about here today, transportation, access to healthcare, really workforce development, all of the things that we know are really important to make sure that our residents have an opportunity to live their healthiest life. That's what we're going to be focused on with our community improvement plan. Franklin County Public Health, we have one goal, and that is equity. Equity is our North Star. It's something that really guides all of our work, and it's something that will guide our community health improvement plan as well. So we're really excited about the opportunity to continue to collaborate. Again, our community health centers, Primary One Health, has just been a phenomenal partner, and I'm looking forward to today's conversation. I don't know if I can keep talking if you'd like, but I know that Alex Jones was going to say a few words about some of our COVID-19 response and some of our vaccinations, but we are really just thrilled to be part of this conversation here this morning. Thank you.
Thank you very much. Thank you very much, Joe, and thank you to Columbus or Franklin County Public Health for all that you're doing in our community to address equity and more importantly, our Franklin County Health Improvement Plan, which we are working very closely with our Franklin County Public Health Agency on. The improvement plan is really to address all of the needs of our communities in Franklin County. As I started, and then you teed up really well, Joe, we are really focused in on COVID-19 and the impacts on older adults. Vaccinating, making sure that their health needs are met, but ensuring that all the vaccinations that older adults should have in order to be healthy are very, very important. And so Alex Jones, who is the Assistant Health Commissioner and the Director of Prevention and Wellness at Franklin County Public Health, is going to start our conversation, and Alex is joining us online. So if you would give her a round of applause.
Good morning, everyone. Happy Saturday. I'm so sorry I'm not there in person, but it's so nice to be with you all virtually. So as was mentioned, I'm Alex Jones. I lead a lot of our vaccination efforts, COVID related and non-COVID related. So was hoping just to spend a minute or so here talking a little bit about the impacts that we see on the senior population and talking COVID, of course, and then some other vaccines as Ms. Tavares mentioned. So as we all know, the COVID-19 pandemic has really impacted our older adult senior population fairly heavily. This was true, especially at the beginning of the COVID-19 response, prior to the days before December of 20, when we didn't have a vaccine. Still now, we do see increased amounts of infection in the older end population, and especially as we look at hospitalizations and deaths. Unfortunately, our senior population is more prone to having those poor health outcomes. And as Joe mentioned, our one goal as being health and equity specifically, it's even more so true in looking at our racial and ethnic disparities for Black and Brown people in Ohio and here in Franklin County as well. So since the rollout of the COVID-19 vaccine in 2020, we have had a December of that year, we've had a pretty good uptake in our population of older adults, about 60 and older, with the primary series, so the 2 doses, and even that first booster. We do want to acknowledge that there's been a lot of confusion recently around the updated booster and that messaging. And I see on the line that I'm joined by one of our communication specialists, Tessa Gatz. And I know we've been working a lot to try to figure out how we can improve that vaccination rate for all of our Franklin County residents, as we know that that booster, that updated booster, is now eligible for any individual 6 months and older who it's been at least 2 months since their last dose. But especially important for our senior population, as they are at the greatest risk of having poor health outcomes. So I'm very excited to say that we are in the beginning stages, but hopefully we'll be able to ramp it up here soon, of developing some public messaging and campaign around getting boosted with the updated booster, with a focus on our senior population. In the meantime, I will put in the chat for dissemination. We have a really amazing Get Boosted campaign website already, but we're wanting to take that a step further. And then I know here in a moment, you'll hear from some colleagues of ours from the Office on Aging here at Franklin County. And I just want to say thank you for all the great work and partnership that we have had with them from the beginning of this response to now. And we couldn't do this, these efforts that we have here in Franklin County without our Office on Aging partners and our federally qualified health center partner. So Primary One Health has been integral with us from the beginning days of testing. What a long trip it's been to now improving vaccination to some of our most vulnerable. So looking forward to hearing more from Interim Director Wingo on what some efforts that are happening with the Office on Aging. So finally, before I hand the back over, I know I spoke a few minutes about COVID-19, but as was mentioned, there are other vaccines and other diseases that our senior population are heavily impacted by. Flu, influenza is something, unfortunately, that our 65 and up population continues to see disparate sickness and unfortunately death. So it is not too late to go ahead and to get vaccinated against influenza for your seasonal flu. I know that there's conversations happening right now about there potentially being both a COVID and flu vaccine in the future. So we will continue to keep everybody updated on that as developments advance there. And then additionally, I would encourage all of our senior population to consider looking at the Tdap vaccine, which protects you from pertussis. So if you're having grandbabies, we want to make sure that you are protected so that because they are going to be too young to get vaccinated until about 6 months of age. So we want to make sure that they are protected through you, as well as pneumonia. A lot of times pneumonia goes co-infects sometimes with flu vaccine and flu disease. So we recommend doing the pneumonia and flu shots around the same time as well. And then finally, shingles. We know that shingles, herpes zoster is a virus that impacts many adults. We were not of the lucky age to be able to be vaccinated against varicella in our lifetime. So we are at increased risk for shingles as we age. So in addition to COVID-19, influenza, also recommend that you're up to date and talk to your healthcare provider, your pharmacist, your Primary One healthcare home, or your health department about accessing these vaccinations. So with that, I'm happy to answer any questions and or turn the call back over. So thank you again so much for having me on this morning.
Thank you very much, Alex. I'm going to ask the audience here if you have any questions while Alex is on the line. And if so, if you would go ahead and raise those questions. Anybody have a specific question? Otherwise, we can go to the next speaker. Yes, go right ahead.
What has she seen as the greatest resistance to being vaccinated?
The question is, what has been the greatest resistance to receiving the vaccination? What are those challenges that people are putting forth as not getting the vaccination?
Yeah, thank you for that question. So we continue to see lots of mis and disinformation continually happening. I am happy to say, I didn't mention it early, that here in Franklin County, we have seen about, I think I checked it earlier this week, 70% of our population have received at least one dose of vaccine. So that's excellent. That's awesome. But we do still have some people that are hesitant to receive vaccine due to some of the, social media, some of the disinformation out there. We have other people who might have received the first dose or series, but then they're unaware that they need to receive additional doses to be considered up to date. And, I completely admit from the public health messaging standpoint, it hasn't been the best. It wasn't the most streamlined, and with some of the guidance ever changing, it's been a challenge to really hone in and to get that message out there. And I will say, I've even had conversations with individuals who say, well, my doctor has told me that, no, I don't need to have that vaccine. So there's a lot more education that we need to do all around from all levels, and really work to get that messaging out there about what does it mean to be updated and what that vaccine, that updated booster can do to protect you and those around you.
Thank you very much, Alex. Next question. Yes.
Okay.
Ms. Shields.
My question is in terms of those who have chronic diseases, that example would be those who are receiving dialysis. Is there going to be a separate cutout where the marketing is specifically targeted to them as a priority and I say, an urgency to get this vaccine as quickly as possible.
And Alex, the question was, for those who have chronic conditions, let's just use the example dialysis, is there going to be a special targeting or messaging to those individuals so that they understand the urgency?
Yeah, absolutely. Thank you for that question. So we know, as you mentioned, those who have chronic kidney disease, those who have diabetes, heart disease, those who have other types of chronic diseases are at elevated risk. So absolutely making sure that individuals know that with you being at elevated risk, that it's even more crucial for you to, be vaccinated. When you're symptomatic, be tested. And I know today's talking about vaccine, but then also looking at early antiviral treatment as well to really help, make sure that they are as safe as possible if they do become exposed or if they become sick with COVID-19. So yes, so we will make sure that individuals in that campaign will maybe turn. I don't know if Tessa, if you have any additional thoughts on that. That you would like to share as the communications expert, but really making sure that people are aware of their risk and that they have the information to keep them safe. So thank you for that reminder for us.
Thank you very much. Anybody else internally? Yes, Mr. Ahad.
Did she mention something about a specific vaccination for when you're around grandchildren?
Mm-hmm.
Yes.
What was that name?
Yes.
Alex, did you hear that question?
I think I did. I heard the grandchildren. So that's such an important one. So yes, so that one is called Tdap. It's tetanus, diphtheria, and acellular pertussis. So really what we're after is that pertussis vaccine, which is whooping cough, because yeah, that's a big one. So before you have a grandchild, and that's one that they recommend that everybody in the family gets to really protect that baby before mom gets it, when she's pregnant, the pregnant person's pregnant, and then also everybody around them.
Thank you for using the common terminology.
They appreciate that you use the common terminology, whooping cough.
Oh, yes. We have all kinds of fun names, I tell you.
Well, if there are no other questions, we're going to move on to our next speaker. Alex, I know you had a time commitment, so if you can stay, fine, but if not, thank you very, very much for your presentation, and we appreciate the work that you are doing with our team members at Franklin County Public Health.
Thank you.
And next, moving on, we have the Health Commissioner, the Director of Operations, Franklin County Board of Commissioners, their Office on Aging, and her name is Shanda Winglet. And we're going to have her come up and give a presentation, and we'll take a few questions while she's up here, and then we'll go to the next speaker. Thank you very much.
Good morning. Is this Good morning.
Good morning.
Good morning. I'm not the best with technology. I have children for that. So I am Shonda Wingo, and I have had all of these titles in the last year, I promise. But as of yesterday, I am named the official director of the office. So now everybody knows. So at the Franklin County Office on Aging, we are a Board of Commissioner agency. And under our agency, the most common program that everyone is aware of is Senior Options. So
Yes, give it a clap.
yes, Senior Options has been around for 30 years. And for those of you that executed your civic duty in November and passed that levy, thank you. And thank you on behalf of all of the seniors that we serve annually with this funding. We could not do what we do without that, so thank you. The mission of the Franklin County Office on Aging is to provide services so that our seniors can remain in their home as long as possible, safely and securely. Other programs that we have in our office are Adult Protective Services. See, I told you I don't know how to do this stuff. Will you help me?
There's no shame.
Oh, I'm an honest person. I'm too honest sometimes. Adult Protective Services is also hosted in the Franklin County Office on Aging, as well as some of our newer programs that the community may not know about. We provide services for our kinship family, so our grandparents and great-grandparents that are taking care of their grandchildren and great-grandchildren. We provide funding and other resources so that the seniors can remain in their home but also keep their families together, which is very important for our community. We also provide services for caregivers, so our adult community that is taking care of older adults, whether it's a spouse, a friend, a neighbor, and our adult children who are taking care of their parents. They are important too. And oftentimes caregivers don't like to ask for help because they believe it's their birthright.
Yes.
And so we are here to change that narrative and let them know that we know you're here. And just this year, we sent Valentine cards to all of our caregivers to let them know that we know you're here. So we like that. We also send birthday cards and thank you cards. You know, all of the feel-good things that sometimes our seniors just don't get. We want them to know that we know you're there, we appreciate you, and we're here for you. We also have a minor home repair program, which is also not a commonly known program. If you're not on social media, I encourage you to follow us because we have a lot of fun videos about the services we provide. And there's a new one that was released just yesterday or the day before on our home repair. Minor home repair could consist of installing a grab bar so that you can get in and out of your home safely, in and out of the shower safely. It could be a wheelchair ramp. We do some electrical. We do some anything, right? If the difference is, you know, being able to stay in your home safely and securely, that's a service that we typically provide. Yes. We can't build you a new house, but we can repair the house that you're in and make it, you know, safe. What else do we do? Family stabilization. Family stabilization is actually a program out of Job and Family Services, and under the Board of Commissioners, the Health and Human Services work together. So you may have heard of DCA Bivens. All of the Health and Human Service agencies are under her. So that's Job and Family Services, Justice Policy and Programs. We have Director Pride here from that agency, as well as child support and then the Office on Aging. So we all work as one team. And the Family Stabilization Unit works with those families who have justice-involved youth, and oftentimes those are grandparents. Trying to take care of their grandchildren, and their grandchild has found themselves involved in the justice system. So we work with those families as well. I think I named them all. I did. Great. Now listen, I have so much to tell you. So I know I'm supposed to be on the camera, but I want everyone to kind of see some of the things that we've done in 2022. So I assumed the interim director role in May of 2022. Prior to that, I was the assistant director of operations. And one of our biggest initiatives was the update to the sliding fee scale. And the reason that that is important.
Director, you might have to be a little bit closer so the audience can hear online.
Okay. So the sliding fee scale is what we use to determine whether or not, or what the copay would be for our senior options program. Until last year, the sliding fee scale had not been updated in 12 years. And so what we know, and I'm sure many of you know, is that every year there's a cost of living increase to those who have fixed incomes. And so what we were seeing is that every year seniors were either moving from a zero copay, creeping up to a copay that they could not afford. And so we thought it was important to make sure that we update that sliding fee scale, and we implement new policy to update it annually.
Yes.
So the current sliding fee scale, when we implemented that, about 55% of our seniors had a 0% copay. When we updated it, took it up to 70%. So we're really proud of that. We're really proud of that, and we have a commitment to make sure that that doesn't happen again. 12 years was far too long not to consider, you know, the world and, you know, those cost of living increases that happen. The other thing that we realized is that the cost of groceries increased from an average annual increase of like 8% to 12%. And seniors just could not afford food. Their caregivers could not afford the gas that it took to take them back and forth to the grocery store. And so what we did, because we have the funding and the ability to do so, is we made our meal delivery free.
Yes.
So sliding fees.
We got a fan.
Yep. So the qualification for that is you just need to be 60 and a
Yes.
Franklin County resident. And if you listen, that's feedback for us. We're doing a great job. I have members of my team here, my assistant director of supportive services and my deputy director of communications. So we are glad that you are excited, as excited as we are. So if you know of a senior, if you are a senior and you need a little extra help before meals, give us a call and we'll get you enrolled at free of cost, as I said. The other thing that we realize is important is partnerships. You've heard of some of our work with Franklin County Public Health. That's kind of cheating because they're in the same building as us. But we love working with partners like Franklin County Public Health as well as Primary One and other community partners, because we have to band together to do this work. We know that our senior population currently is the baby boomer population. It's the largest population. My favorite fun fact about this demographic is by 2050, there will be more seniors than there will be kindergartners.
That's why I said louder.
By 2050, there will be more seniors than kindergartners.
Yeah.
Yeah. And so our agency has a total staff of 106 and 109. We can't do it by ourselves. We need our partners and we need our partnerships. And so one of the other things that we've done in the space of kinship is we've partnered with Franklin County Children's Services, who is going to provide us with some additional funding to help those kinship families, whatever it is. So beds, after school programming, summer programming. Oftentimes when grandparents take their grandchildren in, their heart is ready to take that grandchild in, but their home isn't. So we need to be able to buy food, clothes, everything that children would need to also remain in that home safely and securely. So we're really proud of that partnership as well. And I could probably talk to you for the rest of the morning about all of that great work, but it's amazing, and we're excited about that too. So these are some statistics from last year, so that you can see that I'm not just making stuff up. The proof is in the numbers. For our senior options last year, we served more than 11,000 seniors. Our goal was 10,000. By October of last year, we exceeded that goal. So I know that we can do more. Personal care and respite is another big item that we're really proud of, because we know that as seniors get older, to maintain their dependence, they're not going to ask their children for help. They don't want to ask anyone for help, but they actually need it. And there's no shame in that. And so the fact that we were able to provide 65,000 hours of that respite is huge, because we have to develop trust. And the fact that our seniors trust us to be able to provide this service is amazing. I'm not going to read them all because you can see them, but this is some of the other work that we're really, really proud of. Can we go to the next slide? So, social determinants of health. We also recognize that the social determinants of health is critical. Our team is fully aware that the zip code that you grew up in determines your healthy outcomes and how long your life expectancy is. And so we would not be doing our job well if we didn't take that and infuse that into our work. Because we are a levy agency, we are on a 5-year cycle, and so a lot of our work is on 5-year tracks. So what our team has done is we've taken a look at the social determinants of health, as well as the Franklin County Rise Together blueprint that outlines goals to improve poverty but healthy outcomes for families. And our entire strategic action plan is aligned with all of that. So looking at all of the domains of the social determinants of health, built environment, social context, all of those things. And if the initiative does not have an intended outcome or healthy outcome that aligns with both those initiatives, we're not really invested in that. We want to make sure that even though our seniors are older, that they have access to healthy outcomes. And so all the way to our grant programs this year, when we put that RFP out, it included the social determinants of health. So if you wanted our grant funding, you needed to tell us how your program was going to impact healthy outcomes by way of the social determinants of health before we awarded that funding. And that's how serious we are about making sure that this is infused into our work. The other is along the topic today when we're talking about COVID-19 vaccinations and boosters. We took a look last year in partnership with Franklin County Public Health as well as another community health partner and looked at what are the rates across the county of vaccination rates. And I'll tell you that the zip codes that have the lowest vaccination rates are consistent with the zip codes that are the most impoverished in the county.
That's right.
And so we realized that in order to be intentional and really, focus on that, we needed to focus on those zip codes. We launched a vaccination clinic where we went to those zip codes and actually administered some home-based vaccinations to our homebound seniors. And going back to the question that you had asked earlier around the hesitation around vaccinations, one of the things that we learned about our homebound seniors and their families is that they don't deem vaccinations an emergency, and they only typically leave their home if it's deemed an emergency. So we have some work to do there in changing that thought process and that narrative. Vaccinations are an emergency, and so we were really proud of being able to target those zip codes and go and help those families. The other thing that we did with that initiative is we used a multi-generational approach. We know since the onset of the pandemic that the face of aging is multi-generational. You have more families than ever before living together, banding together to help take care of their older family members. And so what that also means is you have multi-generations coming in and out of the home, providing care. So any person that was either a caregiver living in the home that had access to that senior was also welcome to that vaccination at that time. We're not going to be able to duplicate the homebound one for this year because there's a lot of concern with entities going into homes. So we are going to do another booster vaccination clinic this year where we will be here at this library as well as another library, and I'll tell you where in a second, targeting the same zip codes and bringing the boosters to those families. And our partners in that will be Primary One and Franklin County Public Health. I think they're going to be our best friends for today. So you can see the 43210, 43217, and 43201, 43109, and 43223. Those zip codes are within the top 10 most impoverished zip codes in Franklin County. So we still have work that we need to do, and it falls right in line with the importance of the social determinants of health. These are the locations for the vaccination clinics that we'll be hosting with Primary One and Franklin County Public Health this year. So if you or anyone that you know, because I firmly believe that the other most successful way to engage with our aging population is the friends and the families that are around them. Our entire social media and communication strategy is not so much just to target the seniors, but it's to target everyone around them, the friends, the families, the neighbors. And so this is my plea to you today. If you know of a senior that needs a booster or a vaccination, please, please, please either bring them, have them call us because we can arrange transportation for them to receive their booster or their vaccination that day. But it's very important and very critical. I know when we first launched our TikTok page, people were like, TikTok, TikTok. But when I tell you that we have more grandchildren and great-grandchildren and nieces and nephews that are paying attention to what we're doing.
That's right.
And they're like, Grandma, we need you to go down to the Office on Aging. You know, they have something that they can help us as a family. So we're very, 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 very intentional with everything that we do. So I wasn't crazy when I put us on TikTok. Next slide, please. So that was it.
Are there any questions of the director at this point before we hear the next speaker? Yes,
So I just
Mr.
want to
Brian
ask, in
Hall.
your capacity, what do you think is the chief reason that there is such a great reservation for people to fully comply with the vaccines that have been made available? They have this reason, they have that reason. What do you think is at the forefront of the reservation for not going through the process?
Misinformation.
Misinformation.
I think, we heard a little earlier about even, some of the medical professionals are not providing accurate and consistent information. And I think that it takes all of us. Seniors have built trust with their friends, their families, and their neighbors. And so that's where we all have to step in and be more intentional and having those conversations with those that we love to say, hey, listen, I know what you heard and I know what you think, but can I offer you a different opinion because this is important. You are important to me, and I'd like for you to be here as long as you could. So please, if you hear what I'm saying out of love, please consider, but it's misinformation. Yes, ma'am.
I have a question. I'm here with you, Art. Can we get access to that slide projection just for staff to your presentation? Can you repeat the question?
Yeah, so the question, our friends from UARC would like to have access to our slide presentation, and it is available. My communications director is here. She'll make sure you get it. And then if anyone else wants it, you can reach out to our office and we can have it sent to you.
There's a lot of specific information. It's valuable that we can pass on when we're having conversations and meetings in our community.
Well, you can invite us.
Kevin Johnson's with us every month.
Yeah, we love, so another initiative that I didn't mention, we named it Engaging with Aging, and any entity that is interested in having us come out, because I'm sure I had a lot more to say. I have 72 pages here of information. And so if you find any value in us coming out, we can come out and do a presentation, and we can even tailor the presentation to a specific audience. So we'd be happy to do that.
So, Director, can we flip back to the zip codes that are being targeted? I noticed that 43203 was not listed. Is that reflective of the quota or the target population has already been achieved enough in that area, or we're not rated in the higher?
Not rated in the higher, but you're still in
I
there.
was going to say,
You're still in
that's
there.
our
I think that
area.
was just the top 5. Yeah.
Okay.
Yeah, so you're still in
Yeah, we
the
are.
top 10, yes.
We're working on ours over there. We're working on ours.
Any help that you
You give me
need,
the time.
just let us know. We'll be happy to help you.
And I want to say, Franklin County Public Health, they actually have on their website zip codes, the vaccination on zip codes, all of them. So if you are interested in seeing,
Thank you.
Okay, thank you very much.
I have it right.
Yes, we need it all.
And I just wanted to share again with our partners with Primary One and Franklin County Public Health. We are starting with the zip codes of 43211, 43207, 223, but we also are very happy to expand that. So if there's a need and we have the opportunity to come into a zip like the 43203,
Right.
we can do that again. We want to grow this.
That would be great, because Primary One is located at 1166 East Main Street in our area. Right, in our area. And we will keep pushing our seniors. That's a 5 and 03 is right. When you cross the street, you can be in 03. We gotta get them in there. Thank you, Director.
Thank you so very much.
Oops, I got it.
No, I don't. I know that.
Thank you very much, Director Wingo. We really appreciate it, and congratulations once again on being named the permanent director. We have another speaker, but I do want to just kind of reinforce how important partnerships are. Primary One Health is very, very fortunate to have a lot of partners. And our goal in Franklin County is quality health care for all. That's our vision, and I'm sure it's Franklin County Public Health, the Office on Aging, But none of us can do it by ourselves. We do it in partnership. We each do what we can do in the collective to make sure that our community is healthy. Our next speaker is Kalitha Williams, and I've known Kalitha for a long time. She was formerly a policy wonk over at Policy Matters Ohio, and she is now the Outreach and Advocacy Manager for AARP Ohio. Some of us call it ARP, but they don't like that, so that's all right.
I won't tell anybody. Thank you. Hi, good morning. Good morning. I'm so honored to be here today. I still call Senator Tavares because I know her from my life as a lobbyist, and when she reached out, I'm not even the best person on staff to do this, but I was pretty insistent that I come and do it. And I also want to acknowledge former State Senator Ray Miller, who I also had the privilege of working way under him. I started my career in the Legislative Service Commission internship. Again, where I'm honored to be here today, and I want to figure out how AARP can be a partner with primary health one.
That's right.
Again, I'm Kalitha Williams, and I'm the Outreach and Advocacy Manager. And we have really weird internal titles. So people understand what I do. I tell them that I'm the Ohio Policy Director for AARP, and I lead all of our public policy advocacy at the state level, and I have a team of staff. But AARP at our base level, we're a nonprofit, nonpartisan organization focused on empowering people to choose how they live as they age. We were founded in 1958 by Dr. Ethel Andrus, and she started her work working with retired teachers, and actually found a retired teacher living in a chicken coop. Wow. And that's when she realized we have to have a national organization that is advocating for people as they age to make sure they have the programs and services that they need so that they can age with dignity. Nationally, we have 38 million members, and in Ohio, we have 1.5 million members. Do I have any AARP members?
Yes!
We always like to acknowledge our huge membership base across the country so that we know and see face to face the people we're fighting for. We have an office in Ohio. There are AARP offices in all 50 states and all U.S. territories. And we are advocating for the 50 plus nationally at the state level and at the local level. In fact, we have a specific outreach person based for the city of Columbus. Her name is Raina Sims, and if you have other events, I hope you'll invite her back to talk about the incredible work that we're doing in Columbus and Central Ohio. Next slide, please. As the director acknowledged, Franklin County just isn't aging, Ohio is aging.
Yes.
And unfortunately, some people think that's a bad thing, but we know that as much as we have a population of people who are growing, we have to provide programs and services so that they can thrive in our thriving state. 1 in 4 Ohioans will be 60 plus in a very few years.
Yes.
And if you can believe this, millennials are turning 40. I remember we used to talk about millennials. And Ohio's 60 plus population is growing at a faster rate than any population in the state of Ohio. Next slide, please. And I'm really glad that the director talked about caregivers, because AARP, we want to be the leading voice for caregivers in Ohio and nationally. By our own estimates, there are over 1.5 million Ohioans providing caregiving services. And I don't think a lot of people think about themselves as a caregiver. Before I started AARP, I never thought of myself as a caregiver. I take my mom to her doctor's appointments, and I pick up her prescriptions, and I go with my dad to his doctor's appointments. All of that is important caregiving work. People who take their neighbor to the grocery store, if you check in on them, shovel their driveway, or maybe mow their lawn in the summer, all of that is important caregiving services. And I want to note that our caregiving most of the time is unpaid. And at AARP, we have quantified that caregiving because we want people to understand that this is an important service that we are providing. And in Ohio, caregivers provide over 1.3 billion with a B.
Wow.
Hours of unpaid service that is valued at nearly $17 billion. This isn't on a slide, but on average, our unpaid caregivers provide thousands, up to $7,000 on average, unpaid, unreimbursed dollars out of their pocket to take care of their loved ones. AARP, we have a wide variety of services for our caregivers, including one in your packet that we call Prepare to Care. And it's a wonderful guide for you to work through with your loved one to talk to them about how they want to age, what services and programs are important to them. I'm elated to hear that so many of them, it sounds like, are at the Franklin County Department of Aging. But it's also important to know what do they imagine their life as they age in their community. This is one guide, but if you go to the back and you want to order some more, we just ship them to you. You don't even have to call me for them. Okay. So you can order them online, and I think there's a phone number if you want to provide them to your faith community, other community-based organizations. You just tell us how many you want, and we will send them directly to you. But again, we have lots of caregiving services and resources, and you can find them on our website. So how many caregivers do we have in the room?
Current or past?
Great. Well, thank you so much. I want to acknowledge you and thank you for the services you provide. Next slide, please. The next thing that I wanted to share with you, AARP, at our base level, we're a consumer organization. Our membership are our consumers, and we're the leading consumer voice for people who are in nursing homes. And on the onset of COVID, we became extremely invested to make sure that our consumers who are residents living in nursing homes had the best care and services. You probably know that about 30% of all COVID-19 deaths were amongst residents and workers in nursing homes. And that is a huge overrepresentation when we're talking about less than 1% of the entire population of this country lives in a nursing home. So AARP, we fought vociferously at every level to make sure that the needs and concerns of people in nursing homes were taken care of. And one of the things we did is we produced our own nursing home dashboard, which is still up and is referenced on the slides. And we did, using federal data, we compiled information at the state level about how many people are up to date on their vaccinations. And not just people in nursing homes, but also the nursing home staff, because these are the people that our consumers in nursing homes are interacting with every day. Did they have the protective equipment? Are there staff shortages? So people could know at a national level how states were doing. We continue to update this information on a monthly basis, and you can, if you go to aarp.org, our website, this is an interactive map, interactive data, and you can see how Ohio fares with the rest of the nation. I'm laughing. When I was talking to Senator Tavares, I was asking her what she wanted me to share, and she talked at length about, we want the audience to have educational resources and materials, So I want to point to another piece of educational material in our folder, and this is a tip sheet for if you have a loved one in a nursing home, what you should be asking the nursing home facility. And it's primarily focused on COVID, but we were also looking internally, like, a lot of these questions are just important to know and ask, even outside of COVID. This material is also on our website as well. If you want to print it, if you want to make copies of it, I'm giving you permission to do so. The last thing I wanted to talk about, and at my core level, I'm a lobbyist, so I always want to infiltrate all my presentations with the advocacy work, and we have advocacy leaders here, so I know they'll indulge me. Was a piece of legislation that we were very invested in called Esther's Law. And Esther's Law is named after the mother of a gentleman named Steve Pistor. And his mother was in a nursing home, and he noticed her emotional decline. And he knew something was happening, but he couldn't figure out what it was. And what he did, he snuck and put a electronic monitoring device in his mother's room. And from watching the tapes, he saw his mother was being abused in the nursing home. And he went on a 10-year crusade to advance legislation so that anybody would be able to put an electronic monitoring device in the room of their loved one. And we partnered with him, and last year that legislation was passed. I see two policy leaders in the room, and I cannot tell you how powerful the nursing home lobby is and how they fought this. And we had so many people across the state come together and say, it is important that we are able to protect our loved ones in nursing homes. Many people who are providing caregiving services are providing caregiving help to their loved ones in nursing homes. On average here, there are thousands and thousands of reports about neglect and exploitation in nursing homes. And 1 in 10 caregivers is providing services away from maybe 10, 15 minutes away from their loved one. So this law went into effect, and so now if you have a loved one in a nursing home and you would like to place an electronic monitoring device in their room, here's a tip sheet on how you can do so. Make copies of this, share this with your loved one. The long-term care ombudsman kind of monitors this. If you bump into a nursing home that is resistant, they will help navigate that with you. I can say, when the law was first implemented, there were some challenges. Anytime you do something that the industry doesn't like, they push back a little bit. But I want to say we've worked with the Department of Health long-term care ombudsman, and she has been a tremendous champion for this. And of course, if you have challenges with it, you can also call my office. Next slide, please. Great. Another piece of legislation I just threw it in for a bonus. We have partnered with the Alzheimer's Association around legislation to make sure that peacekeeping officers, so EMTs and police officers, would have additional training when they engage people who have Alzheimer's disease or other dementia, they would be better equipped. You may have read of scenarios where an officer encounters someone with dementia or Alzheimer's disease and they don't know. And sometimes those reactions have been unfortunate and inappropriate, quite frankly. We pushed hard for this legislation to be passed, and I was hoping to show the video, but that's okay. We had one of our volunteers tell her own personal story to lead our advocacy campaign about her father. And he had died a couple years ago, who had Alzheimer's disease, and just all the concerns you have if the public doesn't know how to interact with them. We were successful, and this legislation did pass last year, and it's going to be implemented this year. Like much of policy, there was some negotiation. And one of the things that happened was there was an agreement that the training will be created, but they removed the mandatory element that we were really fighting for. And we're going to continue to fight for that. We're not finished. Sometimes legislation happens in multiple iterations. So we got the first step, that the training will be created, but the next step will be focused on making sure that all peace officers will be required to receive this training. So that is ongoing. And if you see any of our efforts to advance that, we welcome you to join us. Next slide. So here are the calls to action. Make sure to use our Prepare to Care guide. Order them if you'd like more of them to distribute to your community. Share our nursing home tip sheet. Visit us at aarp.org. We're not on TikTok yet, I don't think. We need to catch up, it sounds like. It sounds like we need to catch up, but we are on social media. Obviously, you can become a member of AARP. We have lots, I shared our membership base, and some people are members and they just take advantage of the discounts, which are wonderful. The discounts are amazing. But you can also become a volunteer at AARP. In our state office, we have different volunteer teams. I lead our advocacy volunteer team. Recently, Senator Tavares came and spoke at our volunteer summit to encourage our members to be more involved in the policy advocacy. But we have regional volunteer teams where teams do events throughout Central Ohio. So you are welcome to not just become members of AARP, but also volunteers and help us advance the work that we're trying to do throughout our communities, throughout the state, throughout the country. And I'm happy to answer any questions.
I guess I'm the only one. I don't have a question. I do have a comment in reference to your document about what to look for when you go to the nursing homes and questions that you can ask them. The best, my husband was in a nursing home before he passed, but someone told me, make a surprise visit. And that's one of the best, because you can go in and you can tell them the reason why you're there, and they normally take someone with you and you get to walk around and see what's going on. And sometimes you see things like the floor is not swept, food on the floor, patients are just lying there. I mean, so for us that was very important. But make a surprise visit.
Absolutely. I'm just going to repeat for the audience. We just had a great audience member make a recommendation that it's also a good idea to make a surprise visit to your loved one in the nursing home to see what's going on. And I agree with you. Yes, ma'am.
I wanted to first commend you, particularly on the Alzheimer's initiative. You are, that's one of our primary pillars, because we're in partnership with OSU Neurology and Biomedicine, Dr. Doug Shire, to get more people of color to do clinical trials. All of this is great, but if they don't know how to treat us, you see what I'm saying? We still lose out. And Aunt Ethel will be going down the alley and somebody will say, go get your Aunt Ethel. She's walked away again, and she'll be misdiagnosed. So, this is one of the big things that we do, and you are brain health, and I thank you 1,000 times over for doing that, because people of color, we've got to start participating in those clinical trials, and several of our members have participated. I tried to get it, but they said, I didn't have enough wrong with me yet. No, everything's wrong with me. Just hang in. You becomes a critical key with the people of color with that health disparity, because they're being misdiagnosed and we're missing a lot of great treatment. But they gotta know who we are and what's going on with us.
Yes, ma'am.
I would like to say I've had family members in rehab centers, they come from the hospital and whatever. But piggybacking on what she said, another good thing is always document. Because if you're going in and you see things, and now sometimes this might sound sneaky, but I had a family member to do this. We have cell phones now. They might think you're looking at your cell phone. Take a picture. And this member of my family was in, and they found out something that was going on. And they documented it, kept documenting it, and they got something done. So I say document as well. Have a paper trail.
Right. I'm just going to communicate. So we had some great audience interaction. We had a member of the audience share the importance of Alzheimer's support and help for people who have Alzheimer's disease and dementias, and encourage people to take advantage of clinical trials. And we had another audience member give another recommendation for loved ones in nursing homes to document and to take pictures and keep track of what's happening that way. Yes?
I don't know where this would fall. This is the nursing home or maybe something. I've been in nursing homes before. And some of our seniors are not very pleasant. And when I say I don't know if they've had a rough life, or what, I've heard them speak very roughly to not very appreciative of the people who do work in the nursing home. And I'm not saying this is everybody, but there are cases. And I was wondering if there's any training or any place in the advocacy where people who do work in nursing homes might be able to get some help in terms of how do I deal with this? This person just doesn't like me, or maybe what are some of the symptoms that we can look at and say, hey, she's really just acting like that because she's got issues or something like that. But I'm not saying this is with everybody, but some of them can be pretty, and I guess I don't know what life they've led, but I've seen them be pretty nasty with some of those people. And I know, see, to me, if I'm dependent on somebody to help me to eat or whatever else, I think I better be nice to them, as much as pleasant.
Sure, I'm happy to talk with you separately after the program. I'll be around. Yes. Yes, sir.
Yeah, I just wanted to say very briefly, I have a history of dealing with Alzheimer's and dementia. I just lost my grandfather in 1962 when I was 12. I think they call it hardening of the arteries. I had two sisters die in a nursing home a couple, 2-3 years ago in the same room. So I have concerns about the treatment. So going forward, I don't know how productive it is from an individual standpoint of view to levy your concern to that particular administration, but I think I'm very thankful for ARP. So going forward, perhaps I can pursue connecting with ARP to initiate a process where these things are taken a serious look at.
I'm happy to share my information after the session. There was one other thing I wanted to add, because I also wanted to talk about our work, ARP's work at the national level. In the Inflation Reduction Act that passed last year, ARP, we fought hard and won a fight to include several provisions to lower the cost of prescription drugs. We took on Big Pharma with all of our members, and we got some things done. And one of those things, people have expressed concerns to me like, oh, Khalifa, none of these things are going to happen for several years. But starting this year, there is a cap on insulin drugs for people who receive Medicare. And that was a huge fight. And we know how many of our loved ones have diabetes and need insulin, and we're making all type of life choice decisions that nobody should have to make. for life-saving drugs. And we won that fight. And then secondly, this year, there are no co-pays for Medicare-approved vaccines. So the vaccinations for shingles, pneumonia, if you have Medicare, just go to the pharmacy, tell you to just go and get it done. And we fought hard for that. We are continuing to protect that because pharma is still trying to beat that back. And over the course of several years, we will see the cost of prescription drugs go down dramatically because it'll be the first time that we will be able to negotiate the price of our drugs the way the Veterans Affairs have been doing for decades. So thank everyone who participated and supported that effort. It was the hardest, most robust campaign AARP ever engaged in. It took several years, but our members, when we told them this is the time, everybody stepped up and we fought it and we won. And thank you all for that.
Thank you very much, Kalitha, and thank you, AARP, for all the advocacy. Advocacy is so important. And Esther's Law, I'm just so glad it passed because I had introduced a bill to deal with videotaping or having cameras in long-term care facilities, AKA nursing homes. But it could be a long-term facility that's for rehabilitation. And all of those have your loved ones at the mercy of the team members. Some are very, very good and some are not so good, just like in any other line of business. You have people that do very good work and you have people who do poor work. And so I'm so glad that that passed because we are leaving our loved ones at the mercy of whomever those staff members are. And you know, I'm just thankful for AARP. And another quick fact that I'd like to share with you is that 10,000 people a day turn 65. 10,000 a day. Wow. So just keep that in mind as we talk about the needs for services for older adults. We're not where we need to be. Right. And certainly we're not where we're going to have to be within a very few years. There's not enough services, there are not enough team members who are specializing in geriatrics, there's not enough housing that's specific for older adults, and we want older adults to age gracefully and to live where they choose to live, not where they're forced to live. So I appreciate all the work, and I just want to give a little shout out to AARP. My mom and her sister were advocates for AARP. My mom passed away a couple years ago, as many of you know, and to the Franklin County Office on Aging, she was your biggest advocate and marketer of senior options. Once she got her home assessed, and that's important for everyone to know. The Senior Options Program is for everyone in Franklin County, regardless of your income. You are assessed based on your income. And the services will either be no cost, or low cost, or higher cost, depending on your income. And it doesn't matter if you live with a loved one. It's your income. The services are for you. My mom loved the program and was able to stay in her home until an illness brought her to rehab and to a long-term care facility. So I just want to thank the Franklin County Office on Aging. Share that with your loved ones, because the sooner they get their home assessed, the longer they'll be able to live in their home independently or with caregiving services. Caregiving, home health, and or light cleaning of the home for the loved one. I also want to give some shout outs to my team members who are here. We've got Nicole Gomez, who is our Chief Patient Experience Officer at Primary One Health. We've got DeWynn Harrell, who is our Chief Financial Officer at Primary One Health. We've got Andrea Wilson, who's our Chief Community Services Officer at Primary One Health. We've got Brian Hall, our Community Health Outreach Worker extraordinaire. And we've got our wonderful social media specialist, Grace Hall. And then our marketing, development and marketing manager, Susan Brewer, who is with us. My executive assistant who helped put this together, whose birthday weekend is this weekend, and we were going to ask her to come this morning, Daisha Burston, that many of you interacted with. Give her a round of applause as well. And then, as was noted earlier, former Senator Ray Miller, now publisher of the Columbus Dayton African American News Journal, is here. I share it for multiple reasons. He's my mentor and the person that got me into politics, and certainly serving as a public servant. But the Columbus Dayton African American News Journal is a critical communication piece for our community. Primary One Health advertises in it for multiple reasons, but I also write an article each month, a health article, and then I do a legislative update. And I think it's important because people of color need to have a venue to get important information. And so that is the vehicle that we use, and then we also use El Sol magazine for our Latino populations. I also want to share that there are other partnerships that Primary One Health has with Franklin County and all of its various services and agencies. One being with the Office of Justice Policy and Programs, Rochelle Pry, who is the director and who is here with us. We were just talking on the side, and she was talking about the Resource Center at the Franklin County Jail and the wonderful work that our community health outreach workers are doing there. We are going to do a future quarterly leadership breakfast, advocacy breakfast, on the justice system and programs that are there to serve our loved ones, because many of us have had loved ones who have been involved with the justice system, whether it's youth and the juvenile justice system or adults. And so it's important that we know the services and programs that are involved, and we also establish those partnerships. Finally, I do want to say, I didn't get to share this information earlier, but we had our meal this morning from Freedom a la carte. And for those of you who don't know about Freedom a la carte, it is a social enterprise, nonprofit organization that is helping individuals who have been sex trafficked or individuals who have been a part of domestic violence situations and or both. And so they provide wonderful food services, catering. If you get a chance, pick up one of their cards out on the table, because this is a way for us to partner and to support our nonprofit community. And I'm a big proponent of our helping each other so that we can help our community. At that, are there any other questions for any of our participants? Yes, Mr. Ahad.
I have a question. On Esther's law, that only in Ohio?
Yeah. Well, there are 10 other states that have similar laws. I don't know which ones, but I can give you my contact information. I have a staff member who's the lead on this issue, and she'll know.
The question was asked, is Esther's law in other states? And Ms. Williams shared that in 10 other states, and if you're interested in those other states, you can make contact with AARP Ohio. Thank you all. I just want to thank everyone for being a part of this morning's quarterly community health advocacy breakfast. I do want to let you know that the next one will be, we believe it's April the 8th, but we will send everyone a notice for the next one. And the time, April 8th, and the location, we'll send you all that information. I'm very, very happy with today's presentations. Everyone did an excellent job. Congratulations again, Director Wingo. We are very, very happy for you. And thank you to our co-sponsors, the Office on Aging, and certainly Franklin County Public Health, Joe Mazzola. I just want to share, since we're in this month, we're Black History Month. Next month will be Women's History Month. I am proud of Primary One Health 3 of our officers are African American.
Yes.
And 3 of our officers are women. So we are proud. We are proud. It makes a difference. It makes a difference in who's at the table. It makes a difference when you care that you have a diverse and representative team that's helping you to move the organization, the systems along. And so we thank Franklin County because it's very evident there are lots of women, there are lots of people of color that are in leadership positions. That's critically important. So thank you all very, very much.